Happy to be here. So, how to avoid number one cause of death? You already heard what it is. It's also in the subtitle of my presentation. So, I will talk about the heart health innovations. Maybe a quick raise of hands. How many have done an ECG lately within the last few years? Few. That's good. There is some age groups which that should be mandatory. And I'll tell you more about that. 37.1% Europeans die from heart health conditions. If there could be some good news, it's that 80% of them could be prevented if we knew and acted upon them in the right time. So how to avoid this number one cause of death? First is to follow a lot of biohacking things, hack your heart, follow the experts and who say what to do and what not to do. But the part which I'm going to concentrate is to know about it. So know your heart health solution. Many people are not aware of their current heart health, of their current risks that they are having. The statistics I got from doctors, 90% of doctors say that the patients being brought in are being brought in too late. That means that if they knew about their heart health conditions and the risks they have, they could be prevented. Especially now in the COVID times, many people are locked in isolation, so that means even less option that they will get some proper treatment and their heart condition could be prevented. You might think that it's only an old people problem. In one way, you're right. Risks dramatically increase after the age of 60, depending on the country, 50, 65. But we've done a small study in Latvia screening the children heart health conditions after the age of 12. 10% we found some abnormalities, but there were a few percent, 1.3% cases where we also find some syndromes which none of patient, doctor, or parent was aware of. So it's not something maybe to be afraid yet, as it was quite a small study, but just to keep in mind. So how to know about this heart health solution? As it's written in the Bible, seek and you will find. So we would encourage to search and look for the heart health conditions that people might have, especially if you have some feelings about it. Heart is a tricky organ. Sometimes you might feel something, but it's nothing. At the same time, you don't feel and it's something. So it's not so easy to tell by your gut feeling. At the age of 45, my father told that he's going to die that year. He said so because his father died at the age of 45, and one wizard/astrologist in early days told him that he will have the same fate. At the end, he lived 19 more years and passed away with heart condition. And he did not live till the average life expectancy of his gender. Doctors told me that last 6 months he had a heart condition already. That means that part of his hearts were not working. So that means that if we knew about it, we could act it and possibly interfered. That's when I started to look at the huge technology opportunities out there. Combining them with proper healthcare knowledge and the power of technologies, we can really make the future together. I'm aware that we are part and we are making the history here with the heart health conditions, heart health solutions that we can offer for affordable and accessible cost. And we're doing ourselves it as well with the brands you see on the screen. It is the right time in history as well. It's a paradigm shift at this point. We cannot handle the current healthcare situation without health technologies. The tipping point has been reached. There is a huge growth in online telemedicine services already, and it's going to continue. I want a little bit touch on the silent killer, atrial fibrillation, and why it's the number one cause of stroke, and something that we are already doing to prevent it. If you look at the global map and where this problem is popular, Scandinavian countries, including Finland, is in the red zone. In UK alone, it's 500,000 people walking with atrial fibrillation without knowing that they have it. Basically, they're like ticking time bombs. Here in Finland, we also see quite dramatic numbers, but what I'm concerned about is the planned estimated increase 45% over the next years. We launched a project in Latvia giving family doctors the small devices you see on the screen. Now, every day, hundreds of patients are being screened. We found several arrhythmias already. Just got a call from doctor this morning. And with this kind of small device that I'm holding in my hand, the latest European Society of Cardiology guidelines suggest you can fully use it for a proper diagnostics. You don't need the hospital level 12-lead ECG. This is much more affordable, accessible for everyone. So this is the way how we can change and adjust the future of healthcare, of the heart health. There's also the chronic patient trap. There's a lot of patients now who are aware of their heart health condition or some other chronic condition, and they need the regular doctor visits, which are limited now. So the only way how I see that moving forward is the self-remote monitoring. Number one thing that patient needs in those kind of cases is feeling safety. So he needs to feel safe, so that someone is watching after him. We use the automated data analytics machine learning algorithms to adjust to each individual patient, and the doctors can follow up on that and see which patient needs attention. We're also launching, here it's a soft launch, but launching quite soon, the UPOlife Healthcare Assessment Patch. That means remote heart checkup. It's a small patch that you put on your chest, you get it by post, put it on yourself, wear it for 3 to 5 days, put it back in the envelope and send it back to us. We do the data analytics automatically, and cardiologist just signs the report. This is something that in some age group would be mandatory, but I would suggest like a yearly heart health checkup to know what's your current heart health. As some famous best-selling author from US said, you change your life by changing your heart, but I would like to rephrase that you change your life by getting to know your heart. So please come to our stand. If you're there to check your heart health, we can do an early screening with this small device, and we can help your heart health be healthier. Thank you.